friends. We have Dr. Sridevi with us. Today, what are the complications of diabetes? Why we are worried? For the mother, what can happen because of diabetic is not controlled properly? What are the complications to the baby can happen? Please tell us, doctor.
Thank you. So diabetes is a very important disease. So because it can cause a lot of complications. So what are the various complications can happen during pregnancy? So first is the abortion. So if they are an over diabetes, that means already they have diabetes before conceiving, then abortion is common. So you have to be very careful. Next is they can have a lot of fetal anomalies. That is, the fetus can have either cardiac anomalies or a neural tube defect. So before you plan to conceive itself, your diabetes should be first under control. So that's the second commonest. Then during pregnancy, for example, they develop diabetes during pregnancy. That's known as gestational diabetes. So then it can be associated with pregnancy-induced hypertension. And the other complications is the LICA can increase. Because of the mother's sugar, what happens is the baby's sugar also increases. So because the baby's sugar increases, the baby's urine increases, and that's what causes the increased LICA. So increased LICA can cause pressure symptoms again. So it can cause difficulty in sleeping, it can cause urge to urinate, and because the abdomen is much bigger. So that's about polyhydramnias. Then also they can have a big baby. Other than this, during pregnancy, they can develop more infections than a normal person. More chances of fungal infection, we call as candidiasis. More chance of urinary tract. Pregnancy itself, there's a higher chance of infection. And people who have diabetes, there's a much higher chance they can go in for these kind of infections. And since these infections are quite common, they can go in for preterm delivery. So repeated infections, the delivery, they start having uterine contractions, so the delivery can occur much faster. Now coming to the complications during labor. So during labor, as we already said, it's a big baby. Sometimes what happens is the shoulder, when the baby's head delivers out, the shoulder may get caught and may not be able to deliver. We call that as shoulder dystocia. So any doctor should be aware of the possibility of shoulder dystocia, whether the baby can completely come out. So because of this, there's a higher chance of cesarean section also. And there's a chance of sepsis infection, and the baby and the uterus may not contract normally. So there may be more chance of PPH, or the delivery may be more difficult. This is about during delivery. And following after delivery, there can be, in the baby, they are more prone to have hypoglycemia. The sugar may suddenly drop. They can have hypocalcemia, that is the calcium level is less, the magnesium level is less. They may be more, the baby is very big, so because of that there may be complications. And when you do instrumental delivery, sometimes there may be injury to the baby, and these are some of the complications.
Yeah, they can have respiratory distress syndrome, the babies. Congenital anomalies, already she said, respiratory distress syndrome. And the temperature regulation problems can be there for the baby. Hyperbilirubinemia. The bilirubin level may be high, the jaundice. The baby looks all right. Suddenly they die within second day or third day. Baby looks very big. The doctor thinks everything is all right. No, because the respiratory problem, respiratory distress, the baby can have. The mother also, as he said, labor, incoordinate uterine action. Uterus may not act properly. Suddenly precipitate labor. All the problems of delivery and for the baby can occur. Diabetes, one disease, it can affect, because it can affect the blood vessel, it can affect the nervous system. So all the problems you can imagine can have. That is why it has to be tightly controlled. The woman has to be screened. Then no need to be worried at all. If you don't take care, all the problems can come. Okay? So thank you very much, doctor.
Thank you.